Hi, my name is Deddy. I'm the co-founder of Kodecoon Academy. And today in this Code2Career episode, I've invited one of my friend, also a schoolmate from Hwa Chong Institution. His name is Jia Qian and he's now a doctor. Now, I would love to invite everyone to kind of understand a bit more on the technological advancement that's coming up in the medical industry. So Jia Qian, why not introduce yourself to our listeners?
Hi, I'm Jia Chen. I'm a doctor working at the National Eye Centre. So I was friends with Deddy since I was 16, 17 years old in Hwa Chong. And ever since then, our path diverged. Since JC, I went to med school and he did business and economics. And thereafter, I continued on my journey and became a doctor. And now I'm actually practicing at the Singapore National Eye Centre.
So Jia Qian, thanks so much for making time today. Do share with us a bit more. What kind of educational journey that you took to be where you are today?
Well, so as you guys know, you probably know that the medicine journey is long and requires a lot of hard work and persistence. Long hours as well. So it's basically a path. 5 years of med school. For male doctors, we do national service after medical school. So we get disrupted and we do 2 years of national service when we become full-fledged doctors. Thereafter, we go into residency training, or we decide to leave the public sector and go into the private sector.
I see. I understand that it's a long journey, and there's also the deciding point on whether do you want to specialize in something. And I know that you have kind of taken the path to specialize in the eye, right? Any reason why you want to specialize in that particular organ?
So I find it particularly rewarding training to be a full-fledged eye surgeon. I'm still in training at the National Eye Centre. Why? Because there is so much we can do for each patient with regard to their eyes. It's a very important organ. I feel it's probably the most important, one of the most important 5 senses. And we can give patients who have reversible blindness like cataracts sight again. They can see better, and it gives them a better quality of life. And it really only takes a shorter amount of time compared to a lot of other surgical fields, in my opinion.
Yes.
That's why I'm drawn to it.
I see.
There are also technology advancements, and I guess in where I am at the National Eye Centre, we're at the forefront of it all.
Nice.
So that's good.
Nice. And I'm sure that there are already technological advancement that you see changing the landscape for this particular career. Has there been any that you notice, and how have these changes impacted the role that you are doing now?
Okay. So, I was first exposed to medical technology when I was doing my medical student rotations. I remember being in the operation theatre of a patient undergoing a urological operation. And I first noticed robotic assisted surgery. In my field now, in ophthalmology, we have a lot of technology that we use for diagnosis. In terms of advancements, I'm sure there are a lot coming. Of course, sometimes it takes time for approvals, but in terms of new technologies, there are a lot. Just example maybe about how we use technology to make diagnosis. So we use a special computer to actually image the retina to look out for swelling in the retina for various conditions such as conditions involving diabetes and other eye conditions as well. Of course, these are adjuncts to making a diagnosis, because eventually we have a patient in front of us, and we have to take an account to the patient's signs and symptoms and treat the patient as a whole. You can't just treat the scan. So that's just one way technology helps us.
Right. Are there any upcoming technology in the horizon that you foresee may not be present now, right? But may potentially come in to help the doctors a bit more?
Yeah, for sure. I think there's a very massive scene in artificial intelligence, especially regards in the field of ophthalmology because it's very imaging heavy. I also understand from various colleagues that specialties that imaging heavy, for example, radiology, also have lots of image recognition software nowadays to see things that humans may miss, and maybe the AI is better at picking up.
So in that case, because now if let's say AI were to analyze scans, right, I'm sure it's not 100% perfect, right?
Yeah.
And would that provide any form of risk or downside to this role as a doctor?
Well, I think first we need to prove that the AI is as effective as a doctor, because doctors are human too, so we do make mistakes, and sometimes it's not 100% that you would definitely pick up something every single time. And I'm sure the AI systems are, they're trained by us. They probably, they should have comparable results before we even use them. But that's a good question. Who takes the responsibility? Who
Yes,
who
at the end of the
signs
day.
off? I think AI can only be, or rather, AI maybe should only be maybe the first line of defense, for example. But in the end, the doctor should probably make the final decision, because the doctor has the benefit of having the patient in front of him, speaking to the patient that the AI system probably cannot do, understanding different things, understanding maybe body language, visual cues in front of us to perhaps formulate our decisions better. So the final decision has to be with the
doctors.
patient in the end.
And I think at the end of the day, there could also be false positive, false negative
for
kind
sure.
of scenarios, right?
For sure.
Okay. I know for the past few years we have been going through a lot of COVID-19 situations and all that. How does that actually kind of change the thing that you are doing? Have there been any changes that's brought about by COVID-19?
Well, for sure. So let me just give you quite an example that you probably already know. Is telemedicine. So telemedicine has grown so much during COVID-19. I think before COVID-19, I haven't heard of any phone app showing that okay, you can get a teleconsult with another doctor on the line. Get a simple consult, get an MC, get your medications delivered.
Even MC now.
But with COVID-19, that has definitely gained a lot of traction. People are more accepting that okay, I can get medical advice through the phone, get my medications over the phone, maybe get an MC over the phone as well. And companies as well are more accepting of these MCs. Last time they used to say no telemedicine for a time. That's what I heard from my friends. But now I think people, they are just very accepting of it.
Correct.
And there's a boom in terms of the amount of apps that you can go on. Last time it used to be, I think, things like Doctors Anywhere, maybe. And then now there's so many more.
Is it also applicable to the eye? Are there diagnoses that you can see just from looking at someone's eye?
Yeah. So nowadays, or rather, we have for a long time we have had imaging from the polyclinic. Say the patient comes in with diabetes, you want to screen whether their retina has diabetic retinopathy, which is a condition that diabetes affects the eyes. So we take a photo, and the photo is sent to a centralized site, and we have graders that look at the images. Of course, there are definitely AI systems that will be in play in the future. So that is what we have in my field. In terms of telemedicine for eye conditions, it's quite hard because we have to look at the patient through a microscope, and you kind of have the patient in front of you. But I am sure if in the future, if there are clinically approved handheld devices that we can take retinal photos, we can probably go on teleconsult as well, high resolution photos that can mimic what a microscope does. But at this point, I don't think we have any that is used in clinical practice, to my knowledge.
I see. And I think you mentioned about diabetes patient, right? Getting their retina affected. What about young children? Nowadays they are a lot on the screen. You see that the rise in myopia as well. Has there been patients who are of a younger age, like children, that you see coming to you or coming to seek help in this area?
Yeah, for sure. I mean, well, Singapore is kind of like the myopia capital.
It is.
Yeah, a lot of myopic children, and I'm myopic myself, and I see young patients that are myopic. In the end, what we do advise young children is to have good eye care habits. It's one thing is having good outdoor time, minimize screen time, and that actually does help with slowing the myopia progression. If in doubt, you can always see an ophthalmologist at KK Hospital and then on the National Eye Centre. They can advise you a bit more on what further treatment you can undergo.
I think this is something that is rising, and we do see in our students as well. So sometimes if we get students, especially during COVID-19, when we get students who stand too close or sit too close to the screen, we always advise them to at least have one arm's length away, and we always have like a 5-minute break in between to kind of break the cycle, get them to go toilet, look at somewhere far, right, to rest their eyes. So, Jia Chen, now that with all this technology that's coming in, how do you stay up to date?
Yeah, so sometimes it's hard, admittedly. We do have a lot of things changing in the field, new medications, new imaging technologies, and new approaches to treatment. One way that I do is I go to conferences, try to sign up for overseas conferences. Recently, I just went to one in New Orleans, and you can see what people are publishing, what work they're doing in their own respective organizations. Additionally, there are people that bring the medical tools to an exhibition there, and that's one way that we can actually get updated as well. Other ways is to read journals, medical journals. Nowadays we have the internet. It's very powerful. If you know what to search for and how to search for it, you can find the information that you want to see. So yeah, that's the other way. Other way is probably through word of mouth. We speak to our colleagues, then we sometimes talk about things that are advancing in our field, and some research works that each of us are doing.
Okay. And for yourself, could you share a time when you have to experience trying out a new software or a new technology? How was that experience like?
So very much so. Well, currently doing training as a surgeon, so we often have to have new tools. So things like using a new surgical tool, for example. So recently, I just did use the new surgical tool that I have never used before. It's not new to most people, but it's new to me.
Right.
The learning curve is usually variable. Sometimes it can be very steep. Sometimes it can be a bit gentler. But it's always persistence and how you
practice as well, right?
Being aware of what we're doing and being intentional with each step that we do for in terms of practice.
I'm actually quite curious, in the medical school, because it takes a lot of practice, like you mentioned, right? So who do we practice it on? Could there be, I don't know, is there any simulations before you even go for a real surgery?
So I mean, I'll use my specialty as an example. Because that's closer to home. I don't know about the rest of the other specialties, but so before I started my first cataract surgery, I bought a lot of pig eyes, and then we have a wet lab at the National Eye Centre. So I mount the pig eyes, and we will practice cataract surgery on it. So we will try to express the lens and put our sutures in, and in terms of other forms of surgery, we have a very, very comprehensive machine there called the eye simulator. Basically simulates each step. It trains anti-tremor training, for example. How do we formulate our spatial awareness in the eye? What structures we can't touch. What we have to be careful of. Because we're really working in a tight space. It's a space of maybe about 2 millimeters or 3 millimeters. Or maybe even less for some of the more expert surgeons. They work in even less tighter spaces.
Does that mean that dexterities and hand-eye coordination becomes really important?
Yeah, for sure. Because when we operate, for example, we use all our 4 limbs.
4 limbs.
Yeah, so we have a main instrument in our dominant hand.
Uh-huh.
So you're right-handed, you hold in your
Yeah.
right hand, you're left-handed, you hold in your left hand. And the second instrument holding in your non-dominant hand. One left foot on the scope, the microscope, to move it up and down to focus in and out. And your right foot to give the ultrasound energy or whatever you're giving. Step on bipolar
Wow.
or 3 or something like that.
Okay.
Yeah. So you have
Wow.
all 4 limbs up.
Okay.
And yeah, you have to make sure they all work. Yeah,
I
it's
see.
harder than driving.
Other than driving, okay.
Other than driving.
Okay, you mentioned that. Okay, I'm very curious because you mentioned pig eyes, right?
Yes, yes.
Why this particular animal? Is
Well,
that
it's
closer?
easier to get.
It's just to get. I
Yeah.
see.
I don't think we can. I'm not really explored any other animals, but I think they're closer to get.
I see.
And I guess people probably eat a lot of different parts of the pig.
I'm sure.
Yeah.
Yes.
So yeah,
These
I
are.
was speaking to the butcher.
Yeah.
They want to have the ears. They want to have the pig head. Yeah,
But no,
we
yeah.
have the eyes, yeah, so we have the eyes
Okay.
to practice on. Yeah.
Okay, how do you work with other medical professionals to try to integrate technology into the thing that you're doing?
So there are certain, say for example, there are certain scans. The eye is very, very heavily imaging intensive.
Yeah.
So we have technicians, doing scans for us, like things like using ultrasound to look at structures in the eye, and of course they read it and then but it's for us doctors to figure out what's clinically relevant. How do I work with them? I really just go talk to them.
Yeah.
Ask them, can we image this part? I'll draw on a piece of paper.
Right.
We have like a specific format, like an order form, and say, okay, we want to look at the structure of the eye,
Hmm.
and it's basically giving. I think it boils down to giving
Specific instructions.
specific instructions,
Instructions.
accurate instructions to where you want to see.
Right.
In the end, technicians can image most parts of the eye,
Mm.
but they don't really know what you're looking out for because they haven't seen
I see.
the person in front of you.
Okay.
Yeah, so
Okay.
they will just give you the most generic thing. You don't tell them anything.
Right.
Yeah.
I know when it comes to technology, there's also the ethical responsibility part,
Mhm.
right? Are there even in this medical field, right? There's this a bit of ethics going on as
Yeah.
well. How do you maneuver around this problem?
Well, yeah, I mean, of course, ethics in terms of treatment for patients boils down to firstly, do no harm, you do the best for the patient,
Yeah.
and give the patient enough information to make an informed decision about what they're
Yes.
going to do.
At the end, it's their eyes, their body.
Yeah, in the end, it's presenting them with information that they need to know. And whatever technology is being used, the responsibility is still borne by the doctor, the clinician in front of the patient to make the best decision. And of course, the patient's part as well to decide what's best for himself after being presented the information.
I see.
Yeah, this is a joint decision by the doctor and the patient.
Right. So it's not
Yeah.
just the doctor deciding, right? But it's also presenting the pros and cons, the benefit, the risk and
Correct.
reward,
Correct.
right? And then letting the patient to decide on
That's
their
right.
own.
Yeah.
Yeah. So I'm always curious because for doctors you can't be scared of blood. It's something that a lot of our students who want to go into medical field often say that if I'm scared of blood, then I wouldn't want to be a doctor, right?
Yeah.
Now that you go through this experience, how do you overcome this fear? Was there this fear in the first place?
No, I never had that fear.
Okay.
I mean, I think it's one thing you really know. From what I understand, people know that they are afraid of blood. Of course, there are those that they are not. They don't know. They go into operation theatre and they faint on the floor.
So what happened in those cases, where they are already going through the medical field?
Yeah. So honestly, they have to choose something that
You might not see
you
too
might
much
not
of
see
their
too much
blood.
blood.
Okay.
Yeah.
But when it comes to the eye, do you not too much,
Yeah,
right?
it's quite bloodless.
Okay.
Yeah.
Yeah. And I think just one final question session. There are students who are going through our coding classes and they might not eventually become programmers, right? But they might stay abreast of the technical advances that's coming in. What are some of your advice for those students who want to go into the medical field and perhaps potentially go into your field?
Yeah. So I think echoing your previous point, basically you need to experience what the specialty is like, what the field is like before you go in. I think it's the same across most of the other jobs. Do internship, do an attachment. So that way, as a doctor, you know whether you're afraid of blood or not.
Yes.
Right. If you go into
Early on,
operation
yeah.
theatre before you start the med school, you will know. Okay, Yeah, I'm okay with blood.
Yes.
Yeah, I'm okay with looking at gore.
Gore, yeah.
It's really gore because you do
Yes,
surgery.
there will be
Everyone has to
blood.
go through that. All
Yes.
medical students, whether you become a eye doctor, whether you become a bone doctor, you need to go through
Yes.
medical school. You need to have your foundation. You do general surgery. You need to see how the organs look. Even on the first week of medical school, you have to go and
Wow.
look at cadavers, which are
Cadavers.
essentially dead bodies.
Yes.
And learn from them, learn anatomy. So I think having attachment with a hospital or whatever job you do is important. So you know what you're getting yourself into. Speak to the people there, speak to the doctors there as well, or speak to the professionals there, for example, and understand why they chose it and what and if they regret that decision, why they regretted that decision as well. In terms of so I think that's probably my best advice for people trying to get.
So at least to get some form of attachment, get a teaser before you have that as a career.
Yeah, for sure.
And for yourself, maybe you could share with us a bit more. How's the working hours like as a doctor? What because before they even decide to go into medical school, right? What are some of the considerations that you would like to advise our students?
Yeah, so I think medicine not the only profession that work hard. I also work very hard as well, every single day of the week. I think as doctors, working hours are long, but it gets better as you get more senior, as with a lot of other jobs.
Yes.
Starting out, I remember going to hospital at like 6:30 and leaving at 7-8 p.m.
Wow.
Yeah, as a house officer, and that's not counting overnight calls, which we work overnight, and go back maybe at 1-2 p.m. the next day. Sometimes you don't get any sleep. Of course, I think the situation is changing now. It's been a few years since I've done it, but I think the situation is getting better because there are more doctors that are being trained every year. Of course, a lot of hours are also spent on your weekends trying to study trying to get abreast with medical technology, with advancements in the field, clearing your exams. On top of that, some people do research projects. So a lot of hours are behind the scenes.
Yeah. Wow.
So you must be okay with that.
Yeah. And so you need to really be passionate about this. Yeah.
For sure, you need passion. You need to find meaning in the job you do. Because that's probably the only way that you can get through it.
Yeah.
If not, it's probably the happier way to get through it. I'm sure people can get through it with grit and persistence, but it can be very painful.
Yeah.
Because you sacrifice family time, weekends,
especially at the start. Yeah.
Especially at the start, for sure. You have exams to clear. You'll be in your late 20s, maybe doing exams. If you choose paths that are grueling, training.
I see. So you mentioned exams a couple of times, actually. So there are still exams that you need to take on. Is it more practical exam or theory exam or both?
So as you get deeper and deeper, you need to have more qualifications, right?
I see.
So there are different board exams you have to take to show that I've gained enough knowledge to be a specialist, for example. Of course, there are fields that have less exams. There are decisions that people make. They just want to leave the field. 5 years of med school, so I can do something else. Maybe be a family physician outside, and I think that probably has less exams. But there are also inherent challenges like running a business, which I don't think is easy.
Okay, alright. Okay, thank you so much, Chen. We've come to the end of our episode. I hope that you have learned a lot about the medical field. And I'm looking forward to our next speaker, where we'll invite another friend from another industry to share with you a bit more about the technological advancement in that particular field. Thank you. Bye.